Greetings. Welcome back. This is Dr. Lori Ernsberger with Behavioral Training Resource Center, and this is our three-part series on exploring individuals with autism spectrum disorders. In part one, we looked at the two main characteristics of ASD, and part two is going to be a little bit more on some tips and strategies. And the first tip I want to give you, and this is for all individuals that we meet at work or at school, is we need to treat people with respect and we need to hold back judgment. Oftentimes when I hear from parents who have children on the spectrum, they feel judged sometimes if their child is having a tantrum or if their child is misbehaving when they're at the store. Other people are judging them. So think about that the next time you witness that maybe that's a child on the spectrum that's having difficulty because of all the sensory stimuli that goes on inside a grocery store or department store. And also think about that cashier that you might interact with at the store. That might be a person on the spectrum, and you might be thinking, oh, well, they acted rudely to me, or they were not very socially engaging. But for that person who's on the spectrum as a cashier or any other job, they have to multitask. So they have to count the money and bag your groceries, put it in the bag, and then communicate with you in a socially acceptable way. And that can be a lot. So the first tip is withhold judgment and treat everybody with respect. The second thing I want to point out is because autism was first written about and researched back in the 1940s, so it's been around for decades. We certainly know a lot about individuals on the spectrum, but there is no cure. And my second strategy is buyer beware. It is unfortunate that if you Google search or go on the internet and search treatment for autism, you're going to find a lot of treatments that are not effective, that are really companies that are trying to sell the cure of the day. And it is something that as a professional, I want to make you aware of, that just because the word has the word therapy in it, right? So some kind of therapy, Dr. Lori's therapy, that doesn't make it scientific. It doesn't make it effective. So be skeptical. Help parents that you work with to be critical in their thinking when they look online, because it is unfortunate that so many companies and businesses will try to sell that magic pill, but there is no magic cure. One thing that we do know that works is applied behavior analysis. I'm a board certified behavior analysis, so I study behavior. As an analyst, I'm always examining behavior and, more importantly, how can I teach new skills? It doesn't matter where an individual on the spectrum is, from mild to severe. We can teach new skills that will help them with a long-term quality of life. And so applied behavioral analysis studies behaviors, and it helps us teach replacement skills or teach alternative skills so that child that's in the store doesn't have that tantrum. So the cashier at the store can engage in socially appropriate behaviors. And so if you're going to explore what works in the field of autism, spectrum disorders, and ASD, what works is applied behavioral analysis, which has thousands of research articles that have been proven to be effective when implemented with fidelity. So my tips to you are respect the individuals that you come in contact with, because you don't know, is that an individual on the spectrum? Second, be skeptical about what you read on the internet. Unfortunately, there's just a lot of stuff out there that is not effective and is really can do harm to the child. And the last thing is, if you want to explore what works, look up applied behavioral analysis. You'll find more information about that at my website, Behavioral Training Resource Center. So I'm going to stop here for part two. We're going to move on to part three, where I'm going to give you some of my favorite things in terms of resources where you can continue your education on autism spectrum disorders. Stay tuned for part three.